Sorry, Dr. Isam, I think he's muted.
On someone?
Yeah, someone.
Okay. እንዴት አመሻችሁ? So before I start, I want to congratulate all of you for this successful webinar series. So it's really nice to see that you understood the value of research in medical teaching, and the early exposure to research activities is really pivotal in medical education. So it's really nice to be part of this webinar series. So I think I have met with most of you during your clinical attachment or during our morning lecture. So I'm Tsegazeab Laeke from the Department of Surgery, Neurosurgery division. So today I'll be talking about research protocol writing, randomization, and sampling methods. Can you can see my?
Yeah, ይታያል.
Okay. I'll be presenting to you about research protocol writing, randomization, and sampling methods. So this is the outline of my presentation. So we'll see about protocol writing. It's one of the most important things that you have to do before you dwell on your research project, and then we'll proceed to see the randomization, the importance of randomization, and the different randomization techniques, and then I'll discuss on sampling techniques. So we use research proposal and protocol.
Sorry, doctor.
Yeah.
ስላይዱ እየተቀየረ አይደለም።
Oh no? Okay.
Okay, ተቀየረ።
Okay, ቆይ ከእንደገና ሼር ላድርገው። አንተየ ለሚ አሁንስ
እየተቀየረ አይደለም።
እየተቀየረ አይደለም። ኦኬ አሁንም እየተቀየረ አይደለም።
አይደለም።
So I have to let me stop presenting and so I should share my entire screen, right?
Yeah.
Okay. A window, I think. So okay, አሁንስ ኔክስት ይላል።
አሁን ይላል።
ኦኬ ፉል ስክሪን አይደለም እናንተ ጋር። Okay, so yeah, okay. Let's proceed. So the outline of my presentation will be on protocol writing, randomization, and then at last on sampling techniques. So to start with a research proposal, we use the term proposal and protocol alternatively. So when we say a research protocol, we refer to a structured and formal document which mentions about why we do the research, how we do it, and what we are expecting from our research. So you can assume your protocol as like as a plan. So let's say that you are building a house. So just before you build your house, you just have to plan how to build it. Like you have to know where you build the house and what resources you have to have before you build the house, and also how much money you have to budget. So research protocol is just like similar to planning a house. So before you do your research, you just have to plan. So you have to have a very systematic plan so that your research will be sound, feasible, and also have the expected results. So the purpose of writing a protocol is to convince. So whenever you plan to do a research, you have to have an ethical clearance. And as medical students, you also you will also have advisors. So you have to let your advisors and also the ethical committee that your research proposal, your research will have productive, more important results. And you also have to show that your research hypothesis or question is suitable to what you are practicing. And then you also have to show that it adds up to new knowledge to the field of your study. So when we come to the advantage of a protocol, it lets you persuade the reader of the value, feasibility, and validity of your research. And above all, it also helps you on the write-up of the final research, because most of the protocol components that we are going to see are also part of your final research content. So having a very good, well-prepared protocol helps you tremendously in writing your final research. So the objectives of writing a proposal is to get ethical committee approval, and the other purpose of writing a proposal is also to request a grant. So whenever you do a research, you have to have a resource. So you have to budget, and you really have to look for funding. So having a sound and very good proposal will help you in finding funding. So saying this about the advantage, the objectives, and the purpose of writing a research protocol, then you are now planning to write your research protocol. So what are the contents of a research protocol? So whenever you plan to write your research protocol, your proposal should answer three most important questions. The first question is what's your research about? So it contains your research topic. So whenever you plan to write a research topic, you have to be really clear on the research topic. So it shouldn't be really vague, and it should also be very specific. So it doesn't really have to be a general topic. So let's say that you want to do a research on diabetes. So you don't have to say a prevalence of diabetes, because when you say prevalence of diabetes, it's a very general term. So your research title should be really concise and also specific. So where do you want to study? So your topic should include the place where you want to study your disease or the prevalence of diabetes and other details. But it should not be at the same time a very long topic, so that the reader might not get the most important concept of your topic. And then you should also answer why. So whenever somebody reads your research protocol, something that comes up to the mind of the reader is are you why are you motivated to do this research? So you have to mention your justification, and then there might be many studies that them previous research that and then that's how I'm going to so this includes how will you undertake your research, and is your research design appropriate for your topic, and the other is your plan manageable. So if you let's say if you want to do a research that's a nationwide research, that might not be manageable. So whenever you think of doing a research, it should be really manageable given your time and your budget. And then the other is you have now gathered too much information. You have gathered many studies that were done, and then you might ask, how long should I write? So this doesn't have any fixed length, and it's highly variable and depends on the requirement of the institution. Let's say that you are doing this study in our College of Health Sciences. So if you are doing it, if you are intending it to submit your research proposal to the Department of Surgery, it has its own format. And then the Department of Internal Medicine might also have its own format at the department level. So you have to really talk and discuss with your advisor about the formatting and then the structuring and what type of citations you might want to use and so on. So this is really, it saves you it saves you time, and this you should plan it before you start writing your proposal. And then what are the contents of a research proposal? So I will discuss this based on our IRB proposal requirements, and also the Department of Surgery Research and Ethical Committee proposal format. So your research protocol should have a cover page. So a cover page tells the reader the title of the proposal, who is doing it. Let's say one of you are doing a study. So one of you might be a principal investigator, and then your full name should be clearly written, and your highest degree should be clearly written, and your affiliation. Affiliation means, like, if you are in College of Health Sciences, your affiliation is College of Health Sciences. And then your address, your telephone number, your email should be clearly written. And then you also have to mention your co-investigators. So you might want to do a research that involves let's say, two departments or more than two departments, and then you will have co-investigators. So you just have to mention the names, the affiliation, and the highest degree of all your co-investigators on your cover page. So a good research title should have a fewest possible words, and it should be concise and clear, as I mentioned earlier. And one of the commonest mistakes that we see in our department is that titles containing abbreviations. So you should really avoid abbreviations in research titles, because your research protocol is it's a document that you might want to sell to others, to like institutions that might provide you grant, and so those institutions, those companies might not be really not medically, they might not know medical terms, and these abbreviations might not be internationally standardized abbreviations. So as much as possible, you have to write a full, you have to use full wordings. And you have also to avoid phrases like study of, analysis of, and other phrases like similar phrases. So on the next page, we have a research proposal submission form. So this is more or less it's a summary. So it contains a table format having the principal investigator's name, title of the research project, address of the investigator. And then the next page contains the summary or the abstract. So whenever we say the summary or the abstract, you might wonder, because you usually see abstracts on like fully completely done research journal articles and so on. But proposal abstracts contain a brief background information. So this is like the introduction on your title, your research protocol, and then the objectives that you might want to achieve at the end of your research. And then it also mentions the methods that you want to use, and also it contains the budget and within how long are you going to undertake your research proposal. So this shouldn't be very long. So usually it should be between 250 to 300 words total, and it doesn't, like maximum, it doesn't have to exceed a page. And then you proceed on writing your introduction. So your introduction should outline the topic of your research, and then the problem area or issue you want to address. And then you should have a background and contextual information. So you have to introduce the reader about your research topic, and then it should also include why you want to do this study. So what's the significance of the proposed study? So let's say that you want to do a study on injuries. So the reader should know that injuries are really public health problems nowadays, and the reader should know that this is affecting the young population, and that's really having a very big effect on the economy of the country and so on. So you just have to validate your argument, and so that people who are going to read are really convinced about what you are going to do. And then you might also have a literature review, but this depends on the requirement. So for a proposal as a requirement in residency, literature review is really mandatory. So you have to really put a detailed literature review, and then the literature review includes scientific evidence to the research topic, and also you have to discuss existing literature while demonstrating your work is original and innovative. So one of the things is we see is proposals being written about like other studies that are done in the other side of the world. So people write about studies that are done in Europe, in the US, and so on. So what you have to do is, like, if let's say you're doing your research in Ethiopia, in Addis, or in other parts of the country, so you really have to argue that this your study is not done in Ethiopia. So you have to also mention uh, literatures that are done in other parts of the world, and then come to specifics. So you have to also mention studies that are done in Africa, and if there are literatures in Ethiopia, so you have to mention all literatures done in Ethiopia. Unfortunately, researches that are done in Ethiopia and other sub-Saharan Africa are very limited. So it might be difficult to get as many studies done in our parts of the world, but you really have to work hard in getting evidences in Africa or in the areas that you are working on. So this is really important. And then you proceed on the objectives. So objectives should be presented as bullet points. You have the general objectives and then the specific objectives. So whenever we say a general objective, so it highlights the overall objective of your research. So it doesn't have to be really detailed, and you don't have to mention many objectives under the general objective. So it should be a phrase, and you really have to think what you want to achieve at the end of the broadly. So you have to mention it broadly what you want to achieve, and then specific objectives can be like 3-4 bullets for one research that you want to do. And then methodology. So methodology is also a very important part of your research protocol. So this is where people see details about how you want to undertake your research. So if your methodology is not convincing enough, so people might not like approve your research, and the grant, whenever you apply for a grant, your methodology should really convince, and you should really write it like you will practically do the research. So you have to mention about your study setting. So if it is a hospital-based study, let's say you are doing your research in Black Lion Hospital, so you have to really explain about the hospital. So this includes maybe if you are doing a patient outcome study. Let's say you want to assess operative outcome of patients who are operated for brain tumors. So you have to mention how many patients are being treated for brain tumors in Tukurandas Hospital, how big is the hospital, and how is the neurosurgical activity of Tukurandas Hospital, and how is the patients are being taken care of in the ward. So this is really important. And then you go on discussing on your study population. So study population, you have the source population and also the study population. So you have to explain about your source population. So let's say let's stick with my previous example. So if you are doing a study on brain tumors, your source population is like a general patients who are coming to who are treated for neurosurgical conditions. So these patients might be like brain tumor patients and non-brain tumor patients, but your study population is a subset of your source population. So your study population is patients who are treated for brain tumors. So you have to explain your source population and your study population. And then you proceed in explaining your study design. So there are many types of study designs. So it might be prospective study, it might be a retrospective study, it might be experimental, randomized controlled study, and but there are many study designs. So you have to mention your study design. So whenever you mention your study design, you have also to reason out why you picked your study design. So that's really important. Like for example, if you say I'm going to do a prospective study, why not a retrospective study? Like if you say that I'm just going to do a cross-sectional descriptive study, why don't you do a prospective study? So these are the things that you should explain on your study design section of your methodology. And then the other is data collection tool. So you have to let your reader walk through your methodology. So at the end of the day, the reader or the ethical committee that is going to approve your proposal wants to know how you are going to collect your data. So is it a paper-based questionnaire? Is it a survey? Is it a web-based questionnaire that you want to distribute to your study population? So that should be really explained. And then, so whenever you mention your data collection tool, you might also want to mention how you want to assure the quality of your data. So you have to say something like you want to cross-check all the data collected, and then you have to monitor the data quality, and you have to make sure that the data that you are going to collect is up to your standards. And then once you collect your data, so you have to analyze your data. So if it is like, be it a quantitative study or especially for quantitative studies, you have to analyze your data. So you have to say, like, you have to write in detail what softwares are you going to use and what descriptive statistical analysis you want to do, what correlation methods are going to do, and all these things should be mentioned. And then you proceed on explaining your ethical considerations. So your ethical considerations include you have to mention clearly that you have to take informed consent. So this is really important. So whenever you have study subjects, your study subjects should know the benefits of your research and also the dangers of your research. So you have to take time to explain what the research is all about, and you have to explain to your study subjects that there is no damage to them at all, and also you have to clearly mention that they might withdraw from the study if it is against their will. So you have to do that. And informed consent, like whenever you send your protocols to the IRB, you should also attach informed consent. That's written both in English, and also the informed consent should be interpreted to the mother language of your study subject. So that's also very important. So you don't have to bombard your study subjects with medical jargon words. So you have to really explain all about the research based on at the level of their understanding. And then you have to also mention that you do the research after getting an approval from the Research and Ethics Committee. And the other most important thing on the ethical considerations is you have to keep the confidentiality of patient data. I think you have taken medical ethics, and this is really important. And the medical history of patients is really confidential, and then you don't have to share the patient data with other colleagues and other researchers, or you don't have to use it beyond what you intend to do with the information. And patient data should be stored in a safe place, and anonymity should be kept. So the patient's privacy should not be breached. And then finally, you have to have a timetable. You have to have a timetable, and this should be written as a Gantt chart. So you have to clearly write your timetable for the research. So this is all about protocol writing. If you have any questions, or we can make it at the end. So shall we proceed? Okay, someone?
Yes, someone.
Okay. So okay. ስለዚህ እንቀጥልና maybe at the end we can have questions. So I will proceed with randomization. So one of the methods that you might use in the future is randomization. So whenever, as the name implies, randomization means that you arrange all your experimental units to simulate a chance distribution. So this is really important because it reduces the effects of confounding factors, and it gives you unbiased statistical data. So this is important. If randomization is not carried out, somebody can never be sure whether the effect is due to the treatment or other factors. So randomization is really important. So the first published randomized trial was done comparing streptomycin with a non-treatment control. So you are well aware about streptomycin. So that's the first anti-tuberculosis drug. So advantage of randomization is that it eliminates selection bias, and also it balances the groups with respect to many known and unknown confounding or prognostic variables. And it also forms the basis for statistical tests, and it forms a basis for an assumption of 3 statistical tests of the equality of treatments. So this is the pyramid of evidence in research studies. So randomized control trials are one of the top quality evidences that we can generate by doing research. So let's say so you have many patients, and you say that 90% of patients responded to the therapy. So what comes in mind is how much of the response is due to the effect of the test therapy. So let's say you got a cold, and then you took paracetamol or antihistamine, and then you responded. But at the same time, you have taken other medications. So if you say I recovered because of the paracetamol, is it right to say it might not be the effect of the paracetamol, because you might have taken other medications, you might have rested, and also you have taken too much fluid that gets you rehydrated, and you recovered fast. So all these things are confounding factors. So randomization helps to eliminate all this and to categorize patients and neutralize these confounding factors. So observed improvements can be due to natural course of disease or measurement errors. So let's say in the ward you have a wrongly calibrated weighing scale. So that might give you underweight patients, right? So those are measurement errors. So similar, short-term biologic fluctuation. So it might be the natural course of the disease that patients might have a recovery for some time. So, and the other is inherent effect of other care. So as I have been mentioning, and also placebo effect of test intervention might also give you a recovery, but not due to the inherent effect of treatment. But at the same time, it might be due to the treatment of patients. So, but like as I have been mentioning, factors from 1 to 5 can be controlled for in a well-conducted double-blind randomized control trial through control, randomization, stratification, blinding, and standardization of measurements and care. So randomization is one of the most important parts in doing randomized control trial. So randomization tries to ensure that the effects of spontaneous improvements due to the natural course of disease is equally affecting the comparison groups so that any difference observed between comparison groups cannot be ascribed to differences in rates of spontaneous improvement. So as much as possible, the randomization helps us to fairly distribute patients and to have similar natural course of the disease. And then the other is measurement error. So with the same token, randomization should also eliminate measurement errors. So that if at all there are measurement errors, this should be distributed both in the treatment group and in the control group. And then there are also short-term fluctuations. So the best example is blood pressure fluctuation. So to say that a patient is hypertensive, how many times do you have to measure a patient? At least you have to have two measurements with elevated blood pressure, right? So that's very important. So and also to like the environment or the circumstance that you measure the blood pressure also affects the measurement, right? So if a patient comes to the clinic and if you measure that patient, it's customary that patients will have this white coat syndrome, that their blood pressure will elevate in due to anxiety, right? In the hospitals or in the clinic. So you have to randomize all these effects. So you have to mind where you want to measure. You have to also randomize, and you have to also control the environment. So randomization helps all these things. And the other is other health cares, like individuals may have variable responsiveness to concomitant treatments, resulting in a large effect in one patient and small effect in another. So randomization and standardization of care help to make sure that such effects are equally affecting comparison groups. So let's say that a patient is injured. So a patient who is 60 years old and a young patient who is 20 years old do not respond, right, to your treatment. So a patient who is really old is less likely to respond fast to your treatment. So these are the confounding factors. So randomization helps you to really distribute all these factors, both in the treatment and in the control group, and all these things. It helps all these things to happen by chance. And then the other is placebo effect of test intervention. So placebo effect is the psychosomatic effect resulting from the patient's perceptions and associated emotions about therapy effectiveness, how well or she is being cared for. So you might have observed that if like the nursing care is really good, if you really take care of patients, if you take care of their psychological, emotional part, patients have a tendency to say that I'm okay, I'm recovering, and they might underestimate their symptoms. So these kind of things are placebo effects. So this also should be taken into consideration to say that treatment, the inherent effect of the treatment, is effective. So the goal of randomization is to see the genuine effect of our treatment. And so finally, an observed improvement in a patient may also be due to an inherent therapeutic effect of the test intervention. So whether this was actually the case in an individual patient is nearly always surrounded with some uncertainty. But certainty increases if disease is not known to spontaneously improve. So if the disease is known to spontaneously improve, it's really difficult to conclude that it's the treatment that had effect on the recovery. So whenever we plan, we have to standardize measurement, and that should be maximal. And we have to make sure that concomitant treatment is administered. So how do we randomize? What are the types of randomization? So we have simple randomization, block randomization, stratified randomization, and covariate adaptive randomization. So simple randomization is really simple and easy, as you see here. Tossing a coin and getting a head is 50% chance, right? So there is so there is 50% chance. So randomization is based on a single sequence of random assignments, and this is like the basic and the most simple type of randomization, and it's just like tossing a dice and getting 4 or other numbers. So this is all about randomization, but like there are details about randomization, and it's not like as easy as I presented. So you just have to really read on randomization, and whenever you want to do a study, you just have to choose the ideal randomization technique for your study. And then the other important methodology part is sampling technique. Actually, on your protocol proposal, you have to mention your sampling method, because whenever you do in one of patients might be one of the patient populations might be outside of Addis. You cannot like use simple random sampling or systematic sampling, because you cannot give numbers for all patients in Addis and outside of Addis. So you stratify them based on their geographic location, and then you sample those stratified locations. So the advantage is it's cost effective, because as I mentioned, you take a patient from similar geographic area, so it's cost effective. But the disadvantage is, let's say that you want to to see treatment outcome of diabetic patients or risk factors for diabetes. So the disadvantage is that when you take patients from similar geographic area, the risk factors might be similar.